I am just astounded at the fact that heart disease remains the number one killer of women. And it actually kills more women than all cancers combined. And sadly, we have data that demonstrates that awareness of that fact is actually down in the last 10 years. And I'm curious why that is.
Well, I think our public health campaigns are failing, meaning we aren't getting our message out in the right way. We're not getting it to the right people. And women specifically do not seem to make the connection between their heart and themselves. Breast cancer, by all means, they understand the risk for breast cancer. But if you ask them what they think they're going to die of, they think they're going to die of breast cancer. So I think we need to revamp our messaging because they're 10 times more likely to die from heart disease than breast cancer, and women don't go for screening. They don't know what that means to be screened for heart disease. So there's a lot that we need to do as a medical community and as a society to really empower women to know their risk, be assessed, and care about their hearts.
You have spent a career dedicated to closing this gap, and we're just have learned so much about that. What would you say are a few of the most potent strategies to closing the gap that you have seen as you spent time across the nation and the world talking about this?
Well, I think some of the biggest things that are the problems before we can attack the problem, I think we know that women, for example, don't get guideline-directed medical therapy. So if they have a heart attack, they are less likely to be given life-saving medication. They're not treated in the same way. If they have heart failure, we know they also are less likely to be placed on these life-saving medications. And there's so many disparities in our care that we need to think about this in so many different ways. We need to educate our healthcare community so that they're aware of these disparities, but that they also start addressing and treating women equally. So we need to get rid of the bias in our care, our gender bias. We also need to study women. I mean, women have just been left out of cardiac research. And if we don't start including them in the work that we do to understand how medications work or how interventions work in women versus men, we'll never understand if there's differences. And then, and women haven't been included in a lot of our trials. So it's not just understanding sex differences, but actually including them. Because if we don't include them, we're never going to learn about them. So those are at least some of the things we can do to try to save women's hearts.
Absolutely. What about care in the lifespan for a woman? Because oftentimes when you think of heart disease, you think, gosh, it's probably after the age of after age of 65. What would you speak to as it relates to awareness for women to know what their risks are earlier in life as well?
Yeah, heart disease in younger women is actually increasing. So we need people to understand that it is a killer of young women and older women. And especially when we think about pregnancy and the deaths occurring in pregnancy in the United States, many of the causes of death are actually cardiac. So I think that the way that we should be viewing women is when are we seeing them? And what are the risk factors that might be present already there? So meaning a young woman, what are her risk factors that are unique to women in addition to the traditional risk factors? During times of, when you're in your reproductive years, we should understand that there's things that can occur, things like hypertension during pregnancy, eclampsia, preeclampsia. Those are things that only occur during pregnancy, and we need to be understanding that we're identifying an at-risk woman. And then as we age, there's other things that occur, premature menopause, use of hormone replacement therapy that also increase the risk for heart disease. So it is a lifespan that we want to take care of women. We want them to have a long and healthy lifespan, and that's the way we should be approaching their care.
Thank you so much, Dr. Gulati. Your work has just inspired and informed the nation and the world, literally, in this disparity. And we're just so grateful for all the work that you've done.
Oh, thanks for having me.